Welcome to this segment of About Health. I'm your host, Dr. Mike Lenoir. Today's discussion is with Aldin McDonald, who's a cardiologist. We're going to talk about coronary artery disease. Dr. McDonald, welcome to our program.
Thank you very much, Dr. Lenoir.
Tell us what happens when the coronary arteries get damaged.
Over time, the coronary arteries can get buildup of plaque inside the vessels. And I sort of describe it to patients as imagining a pimple being inside the vessel wall. It's inflamed, it's got white blood cells, and it can obstruct the artery.
Once the artery is obstructed with that pimple, what happens?
When it obstructs the artery, then it impedes blood flow to that area of heart muscle. And when you get impaired blood flow to the heart muscle, you may experience chest pain, usually with exertion or shortness of breath, because when you exert yourself and the heart needs more blood flow and more oxygen, the muscle is not supplied with enough because of that blockage.
That's the way heart attacks occur?
It is, and heart attacks can occur acutely if that plaque, remember that pimple in the vessel, ruptures. So when a pimple pops on the skin, a scab forms or a blood clot forms over that pimple. The same thing or the same kind of thing happens in the coronary arteries. If a plaque ruptures, a clot can form and obstruct the vessel even further in an acute situation.
What are some of the risk factors that lead to plaque formation?
Risk factors that lead to plaque formation include hypertension or high blood pressure, diabetes, high cholesterol, smoking, obesity, and inactivity. And if someone has a prominent family history of coronary artery disease developing at an early age. So it's really key to know your risk factors and address those risk factors early on to prevent plaque buildup.
What kind of diet are you recommending these days for people in order to help them prevent the development of
Sure,
coronary
well, you're
artery
right.
disease?
Lifestyle modifications such as diet and exercise are key to the whole thing, in addition to medical therapy if that is needed. In terms of diet, I typically recommend a well-balanced diet that's low in fats, watching salt intake, watching sugar intake. Watching your diet and exercise can really affect all of the other risk factors that I mentioned. Exercise, for example, and watching your salt intake can help with high blood pressure, can certainly help with cholesterol and preventing diabetes and obesity as well.
Once that plaque forms leading to a heart attack, what can you do today that you couldn't do 15 years ago?
The technology has gotten quite good in terms of treating coronary heart disease. So if it's not prevented and it occurs and you have a heart attack, then the symptoms again for that would be acute chest pain or shortness of breath. You should immediately call 911 because the treatment is opening that vessel with a stent. Stents newer, say over the past 20 years or so, or much more frequently used, and the stent technology has gotten a lot better as well in terms of being more durable. As a healthcare profession, we've also become quite good at managing acute heart attacks when the artery is 100% blocked. Systems have been developed and put in place so that we address that blockage immediately and get that vessel open with a goal of getting it open within 90 minutes of first medical contact, and we're accomplishing that.
And one of the things we're trying to do with About Health is to get people to understand, don't stay home when you have these kinds of symptoms.
Time is muscle, and so the longer that vessel remains closed and your heart muscle is not getting enough oxygen, the more the heart tissue is going to die, and the less chances of us recovering that heart tissue. Not recovering that heart tissue can subsequently lead to heart failure, even if you survive the heart attack. So it's key to come in as soon as possible so that we can get the vessel open as soon as possible.
All right, that's the takeaway point with Dr. McDonald, a cardiologist. About Health will be back in just a minute.